Hello, my friends, and welcome back to Vitality in Seniors. I want you to think for a moment. What if I told you that the road to some of the most dangerous and unnecessary medical procedures is paved with routine checkups? It sounds backward, doesn't it? We're all taught that more testing means more safety, but there's a quiet truth that the healthcare system doesn't often talk about. For millions of Americans over 70, some of the most common tests aren't just unhelpful, they can trigger a terrifying chain reaction of invasive procedures, anxiety, and lifelong complications. Recent studies have revealed that nearly one-third of all medical procedures performed on older adults may be completely unnecessary. One of the tests we'll discuss today, the one I've saved for last, is so problematic that the American College of Radiology has issued stark warnings against it. And yet, it's still being offered in clinics across the country. Today, we're not just listing tests, we're giving you the knowledge and the confidence to become a true partner in your own healthcare. We're going to pull back the curtain on 5 checkups that you should question after 70. And before we dive in, let me know in the comments below, have you ever felt pressured into a medical test you weren't sure about? I'm reading and replying to every single comment because your experiences matter. And if you believe in this mission, take a moment to hit that like button and subscribe to the channel. It truly helps us reach more people. Now, let's begin. Let's start with number 5. A test that is one of the most common hurdles for anyone over 65 complaining of simple fatigue. Number 5, the cardiac stress test. We've all heard of it. If you mention feeling a bit more tired on your daily walk or a little short of breath going up the stairs, the default response is often, let's get you a stress test. It seems logical. Check the heart, find the problem. But here is the uncomfortable truth. For seniors without clear active symptoms of heart disease, like sharp chest pain during exertion, the stress test has an alarmingly high false positive rate. Studies published in journals like JAMA Cardiology have shown this rate can be as high as 40% in older adults. What does that mean? It means the test signals a problem that isn't actually there. But that false alarm is enough to send you down a rabbit hole. The next step is often an angiogram, an invasive procedure where a catheter is threaded through your arteries. And if they find even a minor, stable blockage, the pressure to place a stent can be immense. Let me tell you about John, a 75-year-old grandfather who loved tending his garden. He told his doctor he was getting more tired than he used to. He was sent for a stress test, which came back inconclusive. So, he had the angiogram. They found a 60% blockage, one that was likely stable for years, and put in a stent. During the procedure, the contrast dye damaged his kidneys. John spent a week in the hospital and is now dealing with chronic kidney issues. His fatigue never went away because it was never his heart. He was simply dehydrated and slightly anemic. A better way. For low-risk individuals, a simple resting EKG or a discussion with your doctor about a coronary calcium scan, a low-radiation CT scan that measures plaque buildup, can provide much safer insights without triggering the intervention cascade. From a procedure that can put your heart at risk, let's move to one that can play games with your mind and exploit one of our deepest fears. Number 4. Brain MRI for mild forgetfulness. As we get older, misplacing keys or forgetting a name is normal. But in today's world, our first thought is often the scariest one. Is this Alzheimer's? Out of fear, many doctors will order a brain MRI to rule things out. Here's the problem. An MRI of a 70 or 80-year-old brain will almost always find something. Things like white matter hyperintensities or mild cerebral atrophy. These sound terrifying, but in most cases, they are just the normal age-appropriate changes of a brain that has lived a long life, like gray hair on the inside. A 2022 study in the journal Neurology reviewed thousands of scans in seniors with mild cognitive complaints. It found that while over 80% of scans showed these abnormalities, less than 5% were linked to a treatable condition. For the other 95%, the scan did nothing but create profound anxiety and lead to more tests like spinal taps. Imagine Margaret, a retired 78-year-old librarian. She was sharp as a tack, but worried she was forgetting book titles. An MRI showed those typical age-related white matter spots. The report, though calling them non-specific, sent her into a spiral of anxiety. She stopped leading her book club and withdrew from friends, convinced she had dementia. Her memory got worse, not from a disease, but from the stress of the diagnosis itself. Here's a tough question for you all, and I'd love to see a debate in the comments. What do you think is worse? The anxiety of the unknown, or the anxiety from a test result that might be meaningless? Let me know your thoughts. A better way. Before jumping to a high-tech scan, the best first step is a simple, paper-based cognitive screening test, like the MoCA or Mini Mental State Exam. These tests effectively measure cognitive function without the risk of a panic-inducing and often misleading MRI. The fear of losing your mind is powerful, but for millions of men, there's another fear that has been driving a multi-billion-dollar testing industry for decades. Number 3. The routine PSA test for prostate cancer. The prostate-specific antigen, or PSA test, it's just a simple blood test. For years, men were told to get it annually. The goal? Catch prostate cancer early. It sounds like a perfect example of smart prevention. But the science has changed dramatically. The PSA test is notoriously unreliable. It has a high false positive rate, meaning it can be elevated due to a benign enlarged prostate or even a recent bike ride. But once that number is high, it triggers anxiety and often a painful prostate biopsy. Even more importantly, the PSA test cannot distinguish between a slow-growing, harmless cancer, the kind that an overwhelming majority of older men have, which will never affect their lifespan, and the rare, aggressive kind. This has led to countless men being over-treated, undergoing surgery or radiation for a cancer that would have never hurt them. These treatments come with severe, life-altering risks, including permanent incontinence and erectile dysfunction. The evidence is now so clear that the U.S. Preventative Services Task Force, one of the most respected health advisory bodies, officially recommends against routine PSA screening in men aged 70 and older. A better way. For men in this age group, the conversation should shift from routine screening to informed decision-making. If you have specific symptoms or a strong family history, discuss the pros and cons with your doctor. But the era of every man getting an automatic PSA test is and should be over. Now, this next one is something millions of women in particular are told is an absolute must-do after menopause, but the story isn't so black and white. Number 2, the bone density DEXA scan. The fear of a hip fracture is very real, and the DEXA scan, which measures bone density, seems like a simple, painless way to assess your risk. But here's what they don't always tell you. First, losing some bone density is a natural part of aging. It's not automatically a disease. Second, these scans often lead to a diagnosis of osteopenia, which is just mild bone loss. This term can scare people into taking powerful medications like bisphosphonates. And these drugs are not benign. They come with risks of serious side effects, including esophageal irritation and, in rare cases, osteonecrosis of the jaw, a horrifying condition where the jawbone literally begins to die. A landmark study in the Journal of the American Geriatrics Society followed over 1,200 women over 70 and found that for those with mild bone loss, these medications reduced the absolute risk of a fracture by less than 0.5% over 5 years. For that tiny benefit, they exposed themselves to significant side effects. Think of Eleanor, a 76-year-old retired painter. Her DEXA scan showed osteopenia. She was immediately put on a bisphosphonate. Within months, she developed such severe acid reflux she could barely sleep, and a strange pain started in her jaw. We helped her transition off the medication and onto a robust regimen of vitamin D3 and K2, weight-bearing exercises with resistance bands, and a diet rich in calcium from leafy greens and sardines. A year later, her balance is better, she feels stronger, and has had 0 fractures or side effects. A better way. Unless you have specific risk factors like a history of fractures or long-term steroid use, focus on what's proven to work: strength training, balance exercises, and proper nutrition. These lifestyle changes have been shown to reduce fracture risk by over 20%, far more than the medications in many cases. And now we've arrived at number 1, the checkup that is without a doubt the most aggressively marketed and potentially the most dangerous of them all. It's the test that the American College of Radiology states has no proven benefit and significant potential for harm in people without symptoms. Number 1. The annual full-body CT scan. You may have seen these offered in executive health packages or private clinics, promoted as a futuristic way to catch cancer early. The idea of scanning your whole body for hidden threats is seductive, but it is a terrible idea. Here's the shocking truth. A single full-body CT scan exposes you to a dose of radiation equivalent to 500 chest X-rays. A modeling study published in JAMA Internal Medicine suggested that the rise in CT scans may now be a contributing factor in up to 5% of all cancer cases in the United States. Read that again. The scan meant to prevent disease could actually be causing it. Worse yet is the problem of incidentalomas. These are tiny, harmless nodules, cysts, or calcifications that the scan picks up. They are normal parts of an aging body, but on a scan, they are flagged as suspicious. This sets off a cascade of fear and follow-up tests, from more scans to invasive needle biopsies. Let me tell you about Marcus, a vibrant 80-year-old who taught Tai Chi. He felt fantastic, but was convinced by an ad to get a peace of mind full-body scan. It found a tiny 3-millimeter nodule in his lung. That finding led to a PET scan, a consultation with an oncologist, and finally, a needle biopsy. The result? It was a benign old scar. But the biopsy collapsed part of his lung, landing him in the hospital for a week and leading to a 2-month recovery. All for nothing. A better way? The best cancer screening tool is not a radiation-filled machine. It's you and your doctor. Pay attention to your body. Unexplained weight loss, persistent pain, a cough that won't go away. These are the signs that warrant targeted imaging. A full body scan is like searching for a needle in a haystack with a bulldozer. You're far more likely to cause damage than to find anything of value. So there you have it. The cardiac stress test, the brain MRI for mild memory loss, the routine PSA test, the bone density scan, and the full-body CT scan. The goal here is never to avoid doctors or to reject modern medicine. It's to empower you to become a wise and active partner in your own healthcare. To ask the most important question before any test. What will we do differently if we get this information? And are the risks of the test worth the potential benefit? Here at Vitality in Seniors, my promise to you is to always bring you honest, evidence-based information, cutting through the marketing noise so you can live your healthiest, most vibrant life. Your wisdom and your experience are your greatest assets. Trust them. Now, I truly want to hear from you. Which of these 5 checkups surprised you the most? And here's a bigger question I'd love to see you discuss in the comments. Do you believe doctors sometimes push tests for financial reasons and fear of lawsuits? Or is it almost always out of genuine concern? There's no easy answer, but I want to see a real, respectful conversation down below. If this video has provided you with value, please click that subscribe button and share this video with a friend or family member. You could be protecting someone you love from an unnecessary and harmful procedure. Thank you for taking the time to invest in your health today. Until next time, stay active, stay informed, and be well.